Gulf Regional Council in the Northern Territory provides aged care services to remote Indigenous communities in an area 2/3 the size of Victoria.
We deliver aged care services across 6 sites across the Roper Gulf region, which spans 185,000 square kilometres. And those services range from domestic support, Meals on Wheels to higher levels of care. Some of the challenges that we face as such a large remote region is that many of our communities can become very isolated during the wet season. So a community like Nooka and Numbulwar has been cut off now since just after Christmas, and it's unlikely that the road will open till April. 2 out of the 6 sites that we offer services to don't have a mobile phone network, which also poses significant challenges to our service delivery.
Recruiting and training workers from the community benefits the program and the clients.
We live in an area where culture is very strong and very, very important to people. The aged care service that we provide is done in consultation with the community, and it's at a community level. It's very important that we employ local staff to deliver local aged care services. The staff speak the local language and they're related to the people.
Recruitment can be a challenge for us because of the requirement for candidates who are applying for jobs to supply ID, evidence of holding an OCA card, the requirement to apply for a police check. And many people on remote Indigenous communities don't have ID. Many of our staff members may struggle with some of the literacy and numeracy requirements for the accredited qualifications that they're required to achieve.
While Roper Gulf Council has a strong workforce development model, the Reform Ready review helped them identify an information gap.
The review that we did with the aged care reform with the WIN project, that allowed us to see our organisation. It was a snapshot that demonstrated to us where our weaknesses and where our strengths were.
As a result of the review, we identified that communication was quite a big gap for us in terms of communicating what the reform process was about, and even in communicating in general what our aged care service is about. We've applied for a co-contribution grant to produce a video. Our aim is that the video would represent shots from across our region and include our clients, and also include the measures that we take to support our clients as a way of communicating to community in general and our stakeholders exactly what aged care services are about in the Roper Gulf region.
The WIN model was able to benefit Roper Gulf and help it address its unique challenges in delivering aged care.
For us, it's been a very useful tool to help us manage our change effectively and prepare everybody for the changes ahead.